good afternoon, and thank you for joining us for today's COVID-19 media briefing. This is a Q&A about vaccine data. It is being aired live on YouTube. And joining us today are DHS Deputy Secretary Julie Willems-Van Dyke and Dr. Ryan Westergaard, the Chief Medical Officer in the Bureau of Communicable Diseases. And we begin with remarks from Deputy Secretary Julie Willems-Van Dyke.
Thank you, Elizabeth. Good afternoon, and thank you all for joining us today. Today, I'm going to take you on a tour of our updated vaccine data page, but I wanted to start with data of a different sort. COVID-19 is still spreading in our communities. Our current 7-day average of new confirmed cases is 91, and our 7-day average deaths is 2. Across the country, we are seeing increases in the proportion of cases identified as the Delta variant. And in places like Southwest Missouri and Arkansas, we are seeing COVID disease surges that are once again overfilling hospital beds and ICUs beyond capacity. The Delta variant is not only more transmissible, but it is also affecting people who have previously had COVID. All of this information reinforces the message we've been saying all along. Please get vaccinated. Do it now and make sure your friends and family members get vaccinated too. If you have children who are eligible, 12 years old and older, please get them vaccinated. If you have had COVID in the past, please get vaccinated. If you have people in your life who are hesitant or who need help making an appointment or finding a pop-up clinic, please have those encouraging conversations and give your friends and family members that help, that assistance getting to that vaccine site. The more people who get vaccinated, the more we stop the spread of COVID-19. And the more we stop the spread, the more we prevent more variants from developing, and the faster we move through this pandemic. And let me be frank, stopping the spread means saving lives. Dr. Westergaard and I have said it before, but it bears repeating. Every COVID-19 death is now a preventable death. Every COVID-19 hospitalization is preventable, and we prevent these deaths and hospitalizations by getting vaccinated. It is in our power to avoid future surges and hospitals filled to capacity. So please protect yourself, your family and friends, your community, and your state by getting vaccinated. As of today, we have administered 5,666,149 doses of COVID-19 vaccine in Wisconsin, and 2,787,212 Wisconsin residents have completed their series. So now let me share my screen so you can see what that looks like as a proportion of our population. So just give me a minute here. All right, here we go. You should now be seeing our DHS website and specifically our COVID-19 vaccine data page. As I scroll down this page, we get to the map that I'm sure many of you reference on a daily basis. I know I most certainly do. And you'll see that map defaults to the total population who have received at least one dose. Again, this is the percentage of the total population, not the percentage of the eligible population. We display data like this on purpose because when we talk about vaccine coverage, we are talking about how well an entire community is protected. And that community includes people who cannot yet get vaccinated, like children under the age of 12. On our little dial here, they're represented over in this gray bar. And it's approximately 14% of the state cannot yet receive this vaccine. Now, while we look forward to that changing, in the meantime, it is all the more important for all of us to get vaccinated, and to do so because, as I said earlier, it protects our neighbors and our family members who are in this gray area and can't yet get vaccinated. Now, if you want to see how Wisconsin's adults are progressing in vaccination, we've now added these radio bars at the top where you can see adults 18 and plus who have received at least one dose and adults 18 plus who have completed the series. You'll see that the percentage goes up now because now we are measuring this solely of the eligible population, and we know many of the population, as I said, the children who can't receive vaccine are taken out of this equation now. We are providing this data to allow you to make apples to apples comparisons when you are comparing data to other reports, as many sites are talking about the number of adults who have received the vaccine, not the total population. So we wanted to make this very easy for all of us to make those kind of comparisons. When you scroll down, we also have these new data. And this is GIS data that will show our vaccine coverage at 4 different levels. The map I'm displaying right now is at the census tract level. You can also see it by municipality, by school district, and by zip code. As you can see from the legend, the darker the color purple, the higher the vaccination rate. And as you can zoom in and see this at a very granular level. So for example, let's go in here and look at North Central Wisconsin. And you can see by census tract here how vaccination varies as we look at this in Marathon, Wood, and Portage County. You can also see that this is for those who have at least one vaccine dose. We can also click over and look at those who have had a completed vaccine series. So a couple of things I want you to know about these data as you look at them. First of all, vaccine location is counted as the address of the person who received the vaccine, not where the vaccine was administered. Secondly, you may see a little bit of difference if you go in and download the data, which is also available to you, and add it up and compare it to the map above. Because some of the addresses that we have in the Wisconsin Immunization Registry that is the source of data for all of these maps, do not have addresses that are complete enough to be geocoded in this GIS map. And then last, if you go to the school district data, I want to be clear that just like the maps we have that describe our COVID-19 cases and deaths, this represents the people who live in that school district, so the people who are vaccinated in a certain school district, not the percentage of vaccinated students who attend that school district. So it's all the people who live in that school district. So that is mostly what I wanted to show you on the tour. I encourage you to go to the website and to take a look at these data. But as I bring this to a close, I also want to give a big thank you to our data team and our GIS team at the Department of Health Services. At DHS, we have been and continue to be committed to transparency. And we know that using data to inform decisions results in better and safer decisions. And I'm so grateful to our teams that make it possible for us to share these data with you and with our local policymaker. These new maps can be used by our vaccinators across the state to identify areas in their community where they can focus vaccine efforts. And our goal ultimately is for every census tract in the state to be that darkest shade of purple. So thank you, and I'll now turn it back to Elizabeth, and we look forward to answering your questions.
Thank you. Thank you for that demonstration. And a reminder, to maintain audio quality, please remain muted until it's time to ask your question. If you're able to do so, use *6 to mute and unmute your phone. And in the interest of time, to ensure everyone is able to ask a question, we ask you to limit yourself to just one. And we begin today with Scott Bauer at the Associated Press. Scott Bauer.
Hi, thanks for doing the call today. Julie, it seems like we're way past the point of people who want to get vaccinated. They've done so. The people who want to have been able to access vaccination. So to get this remainder, would you or Dr. Westergaard be in favor of mandating vaccine? And if not, why not?
Well, Scott, I guess I would take issue with your assumption, because you're absolutely right. We're not seeing 50, 60, 70,000 people a day get vaccine, but we continue to see a steady pace of people who are getting vaccine. We continue to vaccinate 5 to 10,000 people a day. And so we are continuing to vaccinate people. What we have done is vaccinate all the very, very eager people. So I think we are very much on a path to continue to use a variety of methods to continue to encourage people to get vaccinated. And I think it's also very important that we continue to give people the information they need to make their own choice about getting a vaccine, including the reality that is before us of the ever-present threat of COVID-19, including the Delta variant. I'll turn it to Dr. Westergaard to see if he has anything he would add to that.
I agree with the sentiment that I don't think everyone who's willing has been vaccinated. And, in my clinical practice, I still have conversations with people who are very willing to get vaccinated and just haven't yet. People have busy lives, and sometimes what they need before deciding to get vaccinated or taking action to get themselves vaccinated is to have a conversation with their provider. And so I think that the next frontier on closing the gap and shrinking our unvaccinated population is to really support and giving vaccinations in primary care providers and creating space for people to ask questions about vaccines and the places that they get care. And I'm very optimistic that as we continue to do that, as we continue to make vaccines available in the places where people get routine medical care from the providers that they trust, that we'll continue to have a upward trajectory of more vaccinations. So this is, vaccinations in general are an important part of healthcare. This is the newest one, so it's understandable that people have questions, but we need to be patient and continue to work and ask and answer questions. And I think we'll continue to make progress.
And one more thing I'd add, I really appreciate those comments about the importance of integrating this into healthcare, Dr. Westergaard, is we've also heard from a lot of people that they're waiting for the vaccines to be fully licensed. And I know the FDA, as you know, Pfizer and Moderna have made application for licensure, and the FDA is continuing to do the important scientific work to evaluate these vaccines for licensure. And I strongly believe that when that decision is made in the coming months, that will provide another level of reassurance to people who may still be in that pondering and waiting mode.
Thank you for that. Let's go now to Rob Sussman at WTAQ in Green Bay. Rob, WTAQ.
Yeah, thanks for taking my question. What do you see the public doing with the information that you've made available on the website? Is this something that perhaps some county level people may be looking at, some maybe school district officials? What do you anticipate being the use for the public with the release of this data? Thank you.
Yeah, counties are pretty big places. And so up until now, we've only provided data at the county level. And so I think what these data do is provide our local health departments and local vaccinators with a lot more granularity about where in their county there are people who may need more vaccines. And so it may influence people to think about, well, let's go into this neighborhood or talk with agencies, with churches, with neighborhood centers, with businesses in a certain neighborhood, and see about setting up a small clinic in a given neighborhood where you're seeing fewer people. It may be, if you look at that map, you see a lot of rural Wisconsin. And, as Dr. Westergaard talked about, people who may have challenges getting away from work and getting into the clinic, farmers have a really difficult life with trying to get away from their work during the day to get into a clinic. So it could be creative ideas about going from farm to farm and offering vaccine to the people who are working in agricultural settings. It could be, as some of our partners at the local level are doing, actually going out and knocking on doors and going door to door in a neighborhood and talking with people about whether they're interested in vaccine, and actually having vaccinators there available to give vaccine in a door-to-door outreach process. So that is very much why we are making these data available. We want our local practitioners to know where in their communities we're seeing higher rates and lower rates, so that they can continue to customize their outreach and vaccination efforts to continue to improve rates.
Thank you for that. Let's go now to Ben Boken, NBC 26 in Green Bay. Ben at NBC 26.
Hi, yes. I just kind of have a question about also the vaccines, obviously. Regarding, people who are worried about, who already have the vaccine, people who are fully vaccinated, people are worried that, barely over half of the population is vaccinated. So that poses a threat to, their health. Obviously, the less people are vaccinated, the higher chance of possibility, even if you are vaccinated, you'd have, you'd get the COVID-19. So how do you reassure people that, past a certain percentage of people getting vaccinated, that they'll be okay? How do you reassure people that, as we're waiting with these 5,000 doses, 5 to 10,000 a day, how do you tell people that that's enough?
Well, here's how I look at it as a fully vaccinated person. I have great faith in the power of that vaccine to protect me. I know that these are highly efficacious vaccines, and I know that our national health agencies like CDC and NIH and the manufacturers are continuing to test the efficacy of these vaccines, how well our immunity is holding, and that when we start to see that immunity wane, there will be recommendations for boosters. And I know our manufacturers are already looking at boosters. Some of you may have heard that Pfizer is preparing to apply for licensure for a booster dose. So the system is in place to continue to provide additional immunity. I also know we're continuously tracking the effectiveness of these vaccines against emerging variants. And that is the one place where there is some cause for anxiety, because if we do not get enough people vaccinated that we can really squash the spread of COVID, we could have a variant emerge that isn't as sensitive to the vaccines that we have. So what I would say to people who are anxious is, please talk to your friends, talk to your neighbors. I mean, I had a conversation with someone today who was encouraged by talking with me about some of the things that they had heard about the vaccine, and we're going to go talk with some of their other friends and neighbors to dispel some of the myths and concerns that are out there. And so we need to continue to do that. But you're right, we're looking at a twofold thing. One is we want to keep increasing the rate of vaccination, and second, we need to keep watching the rate of disease. And here in our state, we've been seeing some really encouraging results with the level of vaccination in our state, but not gone, right? 91 cases per day is still a lot of cases per day. And so that is why this is up to all of us to continue to be moving that needle forward on helping our friends and neighbors get protected so that we can continue to reduce that rate of disease and reduce that risk of variants. Dr. Westergaard, what would you add?
I'd echo the following and trusting the science, which gives us really good confidence that being fully vaccinated reduces one's risk of COVID-19 and in particular of severe COVID-19. The risk of hospitalization and deaths are extremely low among fully vaccinated people. The other piece I'd potentially amplify is the talk to your friends and neighbors piece. We know when people make decisions about their own health, two big things that influence them are, do people who are important to me think I should do this, and do people who are like me engage in this behavior? So the having a good experience with the vaccine and being confident, sharing that story with someone who's having questions can be a good service, can be a very helpful way for people making decisions to protect their own health. So I also encourage people who have been vaccinated to have honest and open, non-judgmental conversations, productive conversations with people that haven't yet been vaccinated, and share why you feel confident that it was helpful, why you trusted the science, that that the benefits greatly outweigh any risks, and continue to have those conversations, because science is very firmly on the side of favoring the benefits of vaccines over the risks and the uncertainty of those risks. So having open dialogue about those decisions is really helpful.
Thank you for that. Let's give the next question to Denise Lockwood, Racine County I. Denise? Denise at Racine County I. Remember, *6 will mute and unmute your phone. All right, we'll try to get back to Denise, and we'll go now to Katarina Velasquez, Spectrum News. Katarina, Spectrum News. Spectrum News. All right, how about Shemaine Mills, Wisconsin Public Radio? Shemaine Mills.
Hi, I'd like to ask a budget question, if I may. Before the pandemic, there were various health groups across the nation that rated Wisconsin and other states poorly for the level of public health funding. Is the amount of funding in the recently signed state budget adequate?
Well, I don't think there's significant investment in public health. There were not significant increases in the budget that was passed in dollars devoted to public health. And so that position we hold as a state, as one of the states with a lower per capita investment in public health, continues to be a challenge for our state. Now, I will say the infusion of CARES dollars and American Rescue Plan dollars has been essential to us throughout this pandemic. And the governor has allocated significant dollars to the response, to both support of our efforts here at the state and in dollars granted to local and tribal health departments to support their efforts at the local level. But using one-time funding as the source of supporting your public health system is a really tenuous approach to investment in public health. And so I think you raise a very important question, Shemaine, about the necessity of the state looking at this investment. Certainly in the governor's proposed budget, there were significant increases in the funding for both our state health department and our local health departments, both to continue to address the pandemic, to prepare for future communicable disease events, and also to address the pandemic of racism and inequities we face in our state. And so as we look to the future, those are important things for the state of Wisconsin to continue to be making investments so that we truly can be the state we aspire to be, where everyone can be as healthy as possible.
Thank you for that. Let's give the next question to Eric Gunn at the Wisconsin Examiner. Eric Gunn.
Hi, thank you for taking this. I'm wondering yet if you have started to see any patterns regionally with the more granular geographic identification of where vaccines are taking place. If you've yet seen any patterns emerging with vaccination status and where higher rates of infection are occurring. Thank you.
Yeah, Eric, what I would say about rates of infection is overall in the state of Wisconsin, our rates of infection are going down. They're going down pretty much across the state. If you look at our disease activity level, I think we're down to only 2 counties that have a high infection rate. Currently, everyone else is going down into the low and medium category, and so that's really great news. And we can't rest on our laurels about that news because we know from the sequencing that the State Lab of Hygiene is doing that we are seeing the same patterns that are happening at the national level. We're seeing a doubling of the percentage of COVID cases that are attributed to the Delta variant over the last few weeks. And, you know, we've seen it in India, we've seen it in the UK, we are seeing it in southern states right now. And there is no reason to believe Wisconsin is any different, that variant won't take off and have a significant increase in our state as well. And the likelihood that it will be in counties or neighborhoods with low vaccination rates is absolutely present. So, you know, as I reviewed the data that we've published, I see a couple of trends, and it's partly why I gave some of the examples I did earlier. Not surprising, and something we have talked about throughout this pandemic, we see painfully low rates of vaccination in urban neighborhoods, and many of those neighborhoods places where people of color live. And so in the city of Milwaukee, in Racine, in Kenosha, in Beloit, and other cities across the state, the neighborhoods with higher social vulnerability continue to be places with lower vaccination rates and continue to need to be a focus of our efforts. But the other thing that you see in these graphics as you look at them is that many of the rural parts of our state are also lower rates of vaccination. You know, what I showed you in north central Wisconsin, a place where I spent much of my career, Marathon County, the city of Wausau, you're seeing higher vaccination rates. And when you go out into the county, in the countries and byways around Athens and Edgar and Spencer and Stratford, you're seeing much lower rates of vaccination. And so again, that's why I gave the example of reaching out to farmers, reaching out to agricultural workers, reaching out in those areas, because those are the places that, let's be very frank, they are at risk if the Delta variant takes hold, which it likely will in our state. And those people are at risk of disease, hospitalization, and death. And we have a cure for that. It's called vaccine. And we all need to work together to use those maps to get the vaccine where it is most needed in our state.
Thank you for that. Now to David Walberg, Wisconsin State Journal.
Hi, thank you. Kind of related to some of what Julie just said, how much do you think the recent uptick in cases and percent positivity in Wisconsin this week is related to the Delta variant? And do you know roughly what percentage of new cases seem to be coming from that variant?
Dr. Westergaard, do you want to address that?
Yeah, for the second part, we don't have real precise data on new cases, meaning the last week or two. As we described before, our system for identifying variants relies on a process called whole genome sequencing, which is done on a residual specimen when someone gets a nasal swab for their COVID-19 test. The leftover material goes to a specialized lab for additional highly technical testing to look at the genome, the genetic sequence. So that takes 2, maybe up times 4 weeks of processing before we get those data. So we're always looking with a bit of a lag. The trajectory's been pretty clear, though. When you look at national data, the CDC released data, I mean, what was seen in sequencing up until last week, and it went, the 2 weeks before that, the Delta variant was about 30%. The 2 weeks, the period that just ended, up over 50%. So that trajectory is pretty clear, similar to what we observed with the Alpha variant, which went from being non-existent to 70–80% of all isolates that we've sequenced over the course of 6 to 10 weeks. We're seeing the same pattern again with this new, even more highly transmissible variant. So it's likely, based on what we've seen on the small sample of specimens that we have sequenced, that the Delta variant, if not already, is going to be attributable to, or most new cases, the majority of new cases are going to be attributable to the Delta variant. So we have every reason to think that if there's more transmission last week and this week compared to a month ago, that is playing some role, because that evidence seems quite clear that when people get infected with the Delta variant, they have much higher levels of virus, so they're more infectious. They become more infectious earlier in the course, so that the chance that any person with infection is going to spread it to someone that they're in contact with is 50–60% higher than it was with the Alpha variant. So I think there's lots of reason to think that that any increases are going to be predominantly driven by that feature of the virus. But we shouldn't lose sight of the fact that individual behavior plays an important role. And there are things we can do to protect against transmission of the virus. And people who are not yet vaccinated, should continue to wear masks when indoors, and we should continue to practice social distancing, to stay home when you're sick, to prevent the spread of illness. So there's things that we have control over this to some degree, but this new circulating variant is somewhat less forgiving. It'll spread quicker at any given level of precautions that we take.
Thank you for that. Let's go now to Ben Krumholtz, Fox 11 in Green Bay. Ben, Fox 11.
Hi, thank you for the opportunity. To follow up on that last question, so what percentage of cases in Wisconsin are being tested for the Delta variant? And is it enough to definitively say that Delta is now the dominant strain in the state?
Dr. Westergaard, do you want to start on that?
I can't give you a precise percentage, but we can have a ballpark, and I can tell you a bit about our process. So right now, 100% of the specimens that are tested at our state lab for diagnosis, meaning all of the specimens that get sent to the state lab for the PCR test to say whether it's positive or negative, those get sequenced. In our partnership with the Exact Sciences laboratory that does the community testing site similarly. So we're capturing, 100% of tests from some of our high volume, but there's other labs in the state that don't routinely do genetic sequencing. So it's still a subset, but as time has gone on and as the number of total cases has gone down, we're sequencing a higher and higher proportion of the positive tests. So I would say that the coverage we have in terms of what percentage of the positive tests is pretty good. And additionally, when we see that the same trend that we see with national data in other states, I think we can be pretty confident that the data are painting an accurate picture, which is that the Delta strain is becoming the dominant strain. So is it enough? I think that's a great question. I think we need that's something that we're working on, is what is, as we go forward, what's the best system, the right level of intensity, the number of resources that we need to invest to do this relatively sophisticated testing to give us that information. And I think all health departments in the CDC are trying to figure that out right now. But I'd say right now we're testing a higher proportion of specimens than we ever have. And so we feel relatively confident that we have good awareness of what the circulating strains are.
And I'll just add to that, based on conversations this week, is that the goal is to test every sample that is positive in Wisconsin. The other issue is, we're sequencing fewer samples because we've had fewer positive cases, which is a good thing. And so the state lab is working with other labs. There are other labs coming on board. We also have our laboratory at the Milwaukee Public Health Department and some of our university partners. So sequencing and our ability to do it is continuously increasing. And I just want to reemphasize what we've been saying is whether the Delta variant is 40% or 50% or 60% should not change the actions that we need to take. It is here. And, I think the danger we've had in this pandemic all along is that I get it. It's human nature. It's hard to believe something until you see it. But what we've seen in this pandemic is what we see everywhere else is going to come to our backyard. We saw it when, the pandemic began in China and spread to Italy and spread to New York City. And we sat here in Wisconsin and thought, well, aren't we lucky because it didn't come that bad to us in April of 2020. And then we had a surge that outpaced most surges across the nation in September, October, November, and December last year. So it is incredibly important that we learn that what we see happening other places is going to affect us unless we take a different pathway. And that pathway is before us. Wisconsin has done a great job of getting to the level of vaccine we are at now. But if we want to protect against these variants that are here and will be here, just like we've seen the pattern every other time, now is the time to do it. And now is the time for people who are not vaccinated to please get your questions answered. I know there are things people have fears about. That is okay. But don't sit at home with those fears. Call us. We have people willing to answer your questions. Call your doctor. Call your family members who have received the vaccine and get answers to your questions. And please consider vaccination so that we don't experience more unnecessary loss of life.
Thank you for that. We go now to Juliana Tornabene, WMTV in Madison. Juliana, WMTV.
Hi, thank you for taking my question. We've noticed, at least in Dane County, that the 12 to 15 age group has actually surpassed the 18 to 24 group in terms of first doses and completed vaccine series. We're wondering why you think this is, and should we be worrying about these college-age individuals and young adults who have been slowing down and getting their shots?
Well, I'll start on that, and then I welcome Dr. Westergaard. I mean, 12 to 15-year-olds, their parents are making their decisions a lot more than 18 to 24-year-olds. And so I'm certain that has some influence on that. I know that our colleges and universities are doing a lot of work with encouraging vaccination. All of the campuses are doing back-to-school vaccination campaigns during orientation for freshman classes that are coming into the university. I think also for students who are attending university, you know, the idea that if you're vaccinated, you don't have to wear a mask in the dorm is appealing. This will be an ongoing messaging campaign and access to vaccine to help this population understand how easy it is and how valuable it is. I think back to school is a really good time for people to get vaccine. I know at the end of the semester, I heard from many students, I just don't want to get it now. I don't want to risk a vaccine side effect when I have to be writing a paper or taking a final. And so beginning of the semester, that's less intense. And so those are all opportunities. We also know not everybody's in a university or school at that age, and so both for this population and other populations, work sites are a really important source for vaccine, and we'll continue to work with employers because, again, it's making it easy. If you just have to walk up the hall or down to the cafeteria at work, rather than think about where can I find a vaccine and drive to the pharmacy and do that on my weekend when I'd rather be doing other things, especially in the summertime. We just want to make things really convenient and easy. But any other thoughts you have, Dr. Westergaard, on the difference between our 12 to 15-year-olds and 18 to 24-year-olds?
Nothing to add. I think you nailed it.
Wonderful. Let's go now to Sharon Bajenda, CBS 58 in Milwaukee. Sharon, CBS 58.
Hi there. Thank you so much for answering my question. My question would have to do with Pfizer's statements followed by the CDC and FDA's statements on boosters. You know, Pfizer released data that there is a possibility of boosters, but CDC and FDA say they're not needed at this point. What do these statements mean for the future of boosters and for the community in general? Thank you.
Dr. Westergaard, do you want to begin on that?
Yeah, interesting conversation and debate in the news just this morning, and I think they're both right. From the manufacturer's perspective, they see some laboratory evidence and other evidence that the level of protective antibodies in patients after they've gotten a dose 6 months later starts to go down. So that could mean, although we don't know for certain that it does mean, that the actual protection against COVID-19 disease might go down. If it does, that will mean that boosters would be beneficial, right? And so it seems like a good idea to be prepared for that eventuality and do the science about how boosters work and when and in what circumstances they're beneficial, or potentially for what subset of people are they beneficial. But FDA and CDC are also right, which is that the data we have right now very clearly say that the 2-dose vaccine series for the mRNA vaccines and the single dose for the Johnson & Johnson vaccine are strongly protective and highly effective against all known circulating variants. So there is no recommendation to get a booster shot because we don't have any clinical evidence. We don't have evidence that from a clinical trial saying that people are better off getting a 3rd dose, for example, than the 2-dose regimen, which has already been proven to lower people's risk by upwards of 90%. So, you know, the way the system works is, yes, we do research, we want to be prepared for what's coming next, but we need to base our recommendations to patients on really solid clinical evidence on what has been shown to be important. And I don't foresee, and it wouldn't be appropriate in my opinion, to recommend anyone get a booster shot or a 3rd dose until we have clinical trial evidence saying that you're better off getting 3 doses than the 2 that you've already had. And we don't have any evidence that that's the case. So I think it's good news on both sides. The drug makers are being proactive, doing good science on investigating this. The clinical guidance committees and the regulators are standing behind very high quality evidence in the recommendations that have already been made, which is that everyone should get a full dose, a full series of a currently authorized vaccine, and be confident that that reduces their risk of severe COVID-19 disease, hospitalization, and death by upwards of 90%. So we are all following the science, and so stay tuned. You know, 6 months from now, the conversation may be different based on what we've learned. But right now, the take-home message is everyone should feel very confident in the currently authorized and recommended series of vaccines that we have.
And let me add to that, you know, that's exactly it. You know, the science happens in the lab, and the clinical science happens in the people who've received the vaccine. And then I'll add a third leg of the stool, which is the pragmatic side. And so it's excellent that the pharmaceutical companies are thinking ahead on these boosters, because if the clinical piece does reveal we need them, you don't make them overnight. You need to have the evidence reviewed. You need to have the authorization from the Food and Drug Administration, and then Pfizer needs to know that they've got a green light so that they can begin to manufacture vaccines in the event that we would need boosters. So there's the scientific piece, and then there's the logistical piece of preparing for these things. And, you know, sometimes we all think a little magically, like we need boosters and they'll be here like this. And so this is, I agree with Dr. Westergaard, this is exactly what should be happening. And we need people to be thinking ahead. And frankly, so do we as a state. You know, we are thinking ahead and beginning to ponder how we would deliver boosters if that recommendation were made, even though right now we know we don't need to deploy those plans. But that is all part of, you know, the science piece of it and the logistical piece of it to be prepared.
Thank you for that. We go now to Sarah Volpenheim, Milwaukee Journal Sentinel. Sarah at Milwaukee Journal Sentinel.
Hi, and good afternoon. My question is about the CDC guidance that was just released today recommending masks for unvaccinated students in schools. Do you have any advice on how schools should track vaccination status for masking policies?
So I think as we've worked with schools across Wisconsin, we will work, we'll provide that guidance, and then the way it is implemented will be individualized within each district. I know our school districts work very closely with our local and tribal health departments as well, and customize national and state guidance for their school districts. What I'd like to say about that guidance is that I think CDC has come out with some very strong recommendations. And first and foremost, that we are ready to have children go back to school, that the value of education is incredibly important. And we're at a point in the pandemic and what we know about disease containment and what we learned through last school year, that we can do that safely. And so I think the mask recommendation has much more implications for our middle and high schools, because we know children are eligible to be vaccinated there. Again, it's just like a work site. You know, in my work site right now, we have that same rule. People who are vaccinated do not need to wear a mask. People who have not yet been vaccinated do need to wear a mask. Anybody who feels safer or would like to wear a mask is welcome to do so. There's no judgment about people who want to wear masks, and it works very well. And I think schools could follow that same guidance, because again, the vaccinated children and faculty and staff who have been vaccinated and are not wearing masks, if someone who is unvaccinated decides not to wear a mask, they are still protected by their vaccine. And so those recommendations that we are deploying across the community have been working and will work in schools. Now, I think the other thing that the guidance says is these are the recommendations right now, and there are local circumstances when they may need to change. If there is an outbreak in a school, everyone will put their masks back on. That would be the first thing that would make sense until you get through that outbreak and see where things are. So masks are something that I think will come and go with us as we move forward. I also want to just emphasize on that CDC guidance that came out, the importance of testing, and particularly remembering that well over half of our school population is not yet vaccine eligible, and the importance, as we've talked about in prior briefings that Dr. Westergaard and others in the department did, about the increasing rate of respiratory illness, that the great testing program we're setting up in the schools will be really critical to help sort out children who have a respiratory virus that is COVID from children that have other respiratory viruses. And along with that, just really important this year that we all live with the, if you are sick, stay home. There is nothing valiant about coming to school sick, nor work sick. Stay home and get better and come back when you're feeling better. And these will also be really important messages for us and for our school district partners to deploy so that we can have a safe, healthy environment in schools where kids can come back to learn, to socialize, to develop in all of the important ways our kids develop and our schools contribute to. So the CDC guidance is multi-layered, and we are really confident in our school districts to interpret it and deploy it in their communities.
Thank you. Next question to Jason Calvi, Fox 6 in Milwaukee. Jason at Fox 6.
Thank you for taking my question. Following up on that last question, I want to ask, if you could look at the data, what do they reveal regarding transmissions in schools here in Wisconsin?
I don't know that we have, let me turn to Dr. Westergaard to see what visibility you have on specific data about disease transmission in Wisconsin. And then I know we can talk more generally about what the literature shows, but anything you would have about disease transmission in Wisconsin?
Well, I think to assign a probability or an event rate, you need a carefully designed study, which some districts have done, and there's some national experience on this. I think what we can derive from our surveillance is that there have been school-based outbreaks. So we know transmission has occurred in school settings or gatherings around school. So a school-based outbreak didn't necessarily involve transmission that occurred in a classroom. It may have been, at an activity. So we know that schools are not invulnerable, not immune to having transmission. But I think the larger lesson, in places where this has been looked at carefully, is that when multiple layers of prevention strategy are successfully implemented, mask wearing and physical distancing and sanitation, that transmission in the school setting, in classroom settings, can be made extremely rare. So that is a good, that is good evidence, a strong lesson that we learned in this first year of the pandemic, which was welcome news, because I think there was a lot of fear that, similar to other respiratory and other types of viruses, that schools and daycare settings could have been the highest risk environment. And that's not what we saw. And it's a combination of the fact that children are not as highly vulnerable to severe infection as adults are, and because we had time to implement multiple different types of what we call non-pharmaceutical interventions in school settings. So schools are only safe because we make them safe. Is one way of looking at it. And I think going forward into the fall, we have learned a lot of lessons about how to make schools as safe as they can be, and that involves very importantly, in my opinion, wearing masks among people who are not yet vaccinated. And I hope that that's a core feature of most school planning going forward.
For that. Let's go now to Alex Moe at WisPolitics. Alex. Alex at WisPolitics, *6 will mute and unmute your phone.
In areas that are lagging behind the overall state rate, or other areas of Wisconsin, like some of those counties, for example, that have lower rates of vaccination, and some urban areas, as you mentioned. What kind of vaccination efforts are targeting residents in those areas?
So we have a wide variety of efforts that are going on across the state. And again, the majority of our vaccine efforts are happening at the local level. And so I cannot describe for you right now what's happening in every single county in Wisconsin. What I can tell you is, in general, what people have found is our larger mass vaccination clinics have served the population that they are most likely to serve. And so most of those bigger clinics are either closing at this point in time or really scaling back in their hours. And vaccination is moving into a much more customized, focused approach to vaccine. So again, smaller pop-up clinics, door-to-door campaigns at employer-based sites. And then very importantly, what Dr. Westergaard was talking about earlier is we're working very closely with both the Wisconsin Hospital Association and our healthcare partners to help them re-engineer the way they're providing vaccine in their clinics to be able to make vaccine much more accessible when anyone presents for healthcare. So whether that's you're in for your child's back to school exam and offering vaccine not only to the child, but the parents who are there, if you're in for a regular checkup, if you're in because you sprained your ankle, if you're in the ER, if you're being discharged from the hospital, if you're pregnant and in for your regular prenatal care, all of these are settings where vaccine should be offered on a regular basis, and working very closely with our healthcare providers on how we can get vaccine into the clinic setting and help them bake that into the clinical process so that we can be offering vaccine there. So it varies, Alex, from community to community. Was really encouraged to read some exciting news from Milwaukee about a door-to-door campaign, community-based organizations from within the community knocking on doors, offering vaccine, working closely with partners like Alverno College and their nursing program and with the city of Milwaukee. So that's an example of a great opportunity in an inner city neighborhood, and we'll be working with a number of other organizations to continue to enhance and customize efforts across the state.
Thank you for that. Let's go now to Denise Lockwood, Racine County I. Denise, Racine County I. And then a last call for Spectrum News. Katerina at Spectrum News.
Hi there, no questions at this time, thank you.
Okay, thank you so much for that. And with that, we will wrap up today's briefing. We want to thank Deputy Secretary Julie Willems-Van Dyke and Dr. Westergaard, and of course, all of you for participating. We ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.